All right, so on the program this morning, we're going to be talking health, like I said, and we're going to be answering one or two questions. We're continuing our advocacy for cancer, but this time around, we are unmasking the A to Z of melanoma in Nigeria. And joining me on the phone line this morning, Dr. Muhammad Habib is a consultant radiation and clinical oncologist with MedServ Luth Cancer Center. He's actually the chief clinical coordinator for that particular center at Luth right here in Lagos. Dr. Habib, it's nice to have you join us. Good morning.
Good morning. Thank you for having me.
Great. All right, so we're doing cancer advocacy on the program this one, and a lot of times when people hear about cancer, there's always this kind of skip of the heartbeat, so to say, and they begin to wonder what is it. But there's a name here that we need to really demystify. We're talking about melanoma. So what kind of cancer is that?
Melanoma is a skin type. It's a skin cancer. It's the most aggressive form of skin cancer, even though it's not the most common, but it's the most aggressive, and it's usually occur in the 5th to 7th decade of life. And it accounts for between 19 and 38% of all skin cancer. And melanoma can be very dangerous if caught late, that at a late stage. Unfortunately, this is the stage that it is most often caught in this part of the world.
Right. Cancer presents very late in this part of the world, like you said, and that speaks a whole lot to how often we diagnose, or perhaps how often we present ourselves for diagnosis. It's not one of the very common cancers, you said, right?
Yes.
And
yes. Yeah.
Which of the sexes does it affect the most, male or female?
Well, there are varying reports. Most of the time, most reports say it occurs more in men, but in some parts of the country, we hear that it's also more common in women. In some, not central parts, it's slightly more common in women, but in the southwest, it's mostly common in men.
Okay, because the kind of cancers that we're used to, if it's not breast cancer, if it's not cervical cancer, if it's not prostate, all of that seem to be grouped into the very uncommon kinds of cancers. But you're saying now that if we come across 10 Nigerians in this room, for instance, Dr. Habib, how many of them will come down with melanoma?
Less than one.
Less than one. So it's very uncommon.
Yes, it's not that common. No, it's not common.
So what causes melanoma? What are the things that could make it present?
Okay, melanoma usually originates from melanocytes. These are pigments in the skin that give us the skin color. They are dark pigments usually that give us the skin color. And I'm sure if you look at your skin, everyone will see a birthmark. A birthmark, that's a dark skin mark or a light one.
Right.
Most of the time, people who have many of these marks, many birthmarks,
right.
And people who have moles, and it's more common in albino than in dark skin people. At the same time, it's more common in people who are blonde. That's among Caucasian, it's more common in blonde, people who have blue eye or red eye, and also light ultraviolet radiation from the sun is said to increase the risk. Also, exposure to some form of chemical will also increase the risk. And if there is a family history of melanoma, then it predisposes those in that family to higher risk of having melanoma.
Right. So a lot of times when these diseases occur, there's always one or two kinds of symptoms that it begins to exhibit. How will I know? Or what are the things that would present that this person is coming down with melanoma?
Melanoma, usually, like I said, will start from a birthmark. And you can see that the birthmark may start growing bigger with a larger diameter, often more than 6 centimeters. And then you can also see that the color changes. It becomes either darker or lighter, or multiple color of that lesion. And also for melanoma, we also see that the margin becomes irregular. That's the margins around the tumor becomes irregular, and it could also present as a chronic ulcer. That is a wound that refuses to heal. any of these signs and symptoms, if it is not taken seriously, then it grows to invade the structure underneath, and it can even spread to other part of the body. Melanoma often occur in the sole of the foot, sole of the hand, especially in women, but in men, usually the sun-exposed area. That's the face, the shoulder, the trunk. Anywhere that is exposed to sun is usually more likely to develop melanoma than those places that are clothed. Right. And usually, like I said, it starts from a birthmark.
Mm-hmm. So for doctors like you, at the site of the skin, can you say this is going to turn out to be melanoma, or it's just an ordinary skin disease?
So that will be, if there's a sore on the skin, then we investigate it. The earlier you get to the physician, the better, so that it is investigated. It is from investigation we can be able to differentiate. They will take sample of the wound and send to the lab and check if the wound have malignant cells, especially from the melanocyte or not, and then we'll be able to distinguish it, the two, from that melanocyte, melanoma, and the one that is not melanoma.
Right. Now, earlier on, you did say that this is a kind of disease that affects more of the elderly, so to say, those within the 5th, 6th, and 7th decade. Is that correct?
Exactly, 5th and 7th decade.
Right.
That's very correct.
So this is a disease that discriminates against the older people, so to say.
Exactly.
If you look at it from that perspective. But is it curable?
Melanoma, just like most other cancer, are curable when detected early. So if it is detected in stage 1 and managed appropriately, over 95% cure rate in 5 years is achieved.
95%?
Over.
Wow. Okay, so that if it's detected early.
Exactly.
Now, detecting early means what now? What stage? Because I know for you doctors, I say the kind of classification you put into skin detection, cancer detection. So what stages are we talking about here?
To simplify for that, stage 1 and early stage 2.
Okay, stage 1 and stage 2. By the time it gets to stage 3, is it getting late?
By the time it gets to stage 3, it's getting late because it's invading the structure under the skin. And when it does that, melanoma is very aggressive. It spreads very fast. And once it's in stage 4, it becomes very difficult to treat.
Are there some myths that are woven around this kind of disease, so to say?
Yeah, the myth is that just like every cancer, that is a death sentence. However, this myth needs to be dissolved. It needs to be abrogated because, like most cancer, if it is detected early, yes, there is cure.
Okay, and also there's a myth that some say black people don't get cancer. Is that correct?
Yes, some people think so, but in the past, that used to be what we think. But today, we are seeing a lot of cancer patients, and a good number of them that present early are getting cured. The Medsed Cancer Center is about 7 years now, and we've treated over 14,000 patients in this center.
Wow.
That's to show that we are seeing cancer patients.
All right, then. So let's look at the areas again. You said melanoma is likely to show up underneath the soles of your feet. And
soles of the feet. That in Nigeria, that's the commonest. 70% of melanoma in Nigeria is from the soles of the feet.
So soles of the feet here, is it going to be swelling, or do we have
There will just be a small wound. A small wound that refuses to heal. And and usually when you look at the wound, you see a dark mark on it. Usually it is dark. Not in all cases, but most cases it is dark, and it keeps to expanding. And many patients will tell you that it heals when they take antibiotics and then recur. So it heals and recur, heals and recur, heals and recur. That's usually the nature. And usually they don't know, they don't have a history of trauma, no puncture. The thing just starts by itself in most cases. And then it heals and recur, heals and recur, and you see black spot on it. Usually, this is how it presents.
Right. And how do we differentiate that? Because somebody who has diabetes is likely going to also come down with a wound, and that refuses to heal. So how would you know this is going to turn out to be melanoma, or rather just diabetes, as the case may be?
Okay, so most people with diabetes already have long-standing history of diabetes before they see the wound. And most of the time, for diabetics, they will have numbness. That means they won't have good feeling in that part of the feet. So the wound usually is painless, and it's usually wet. And with history of prior history of diabetes, we query diabetic foot. However, the best thing to do is that whenever we see a wound in the leg that refuses to heal for like a month, we go to the hospital, because the gold standard of discriminating between diabetic feet and melanoma is to take biopsy, take it to the lab, and that will show you what it is.
Okay. Let's talk about some behavioral patterns that could, be susceptible to coming down with melanoma. What are some of those behaviors or risk patterns?
Yes, one. We must note, if we have family members who have melanoma, then that should increase the index of suspicion that if we have any wound in a member in that family, it should take it serious. It could be that any chronic ulcer, that is a wound that refuses to heal, it could be melanoma. Okay. Secondly, exposure to sunlight. Sun has what we call ultraviolet radiation. That is ionizing radiation.
Okay.
So this ionizing radiation also will increase the risk of having melanoma, especially in albinos. But not just in albino, but the risk is higher in albinos in our own part of the world. In the other part of the world, that's with the West, albino, blonde, people with blue eyes or red eyes, all these people are at higher risk. Then exposure to chemicals. They are like vinylchloride chloride. There are some chemicals that can be used in the factory that could expose us to risk of having melanoma. Okay. Apart from sun. Yes. Also, people who have multiple birthmarks, plenty of birthmarks, and people who already have chronic ulcer due to other reasons.
Okay.
And people who have multiple moles. Moles are also a type of skin tags. If someone has multiple moles, it should be more conscious to having melanoma. That you should look out for it. Not necessarily that the person will have it, but it should be more suspicious. It should have higher index, so that if it comes, you quickly detect it and it will be eliminated.
All right, then. Lagos Traffic Radio 96.1 FM. Your Side Mirror is the program, and I have Dr. Muhammadu Habib of the MedServ Luth Cancer Center. And this morning, we're looking at a very, very uncommon kind of cancer. It's called melanoma. It's a skin cancer, and he's been giving us some of the signs, the symptoms, the causes, and how we can manage it as well. Getting back to the roads, reports from the Okwebi Island corridor says there's a broken down Volkswagen bus having back hub problem. This is at Awoshika bus stop, Okwebi Road, inwards Toyin roundabout. So Awoshika bus stop, you have that broken down bus there. A tow truck already contacted for evacuation. Traffic affected, and I understand that it's backlogged towards Adebola House for now, but we still have a very, very good structure in place. Traffic managers are there trying to give better advice on how you can navigate through that corridor right now. Okay, let me see. Okay. All right. So the latest update with that it's been taken off the road. Yes, that bus has been taken off, so it's much better for those of you who are navigating through that corridor as well. All right. Let me see. Victoria Island. Would it tell you that it's still very encouraging? For those of you who are coming in from the Marwa and heading towards Lekki, traffic building up gradually. you have lots of influx within that particular corridor. Lekki intersection, you have it's slow and steady. And from there, heading towards the toll plaza is steady, both in and out. We can also tell you, toll plaza heading towards Sandfield, busy but progressive. And of course, from there, towards the school corner. And of course, Sandfield linking up with the corner is still gradually okay for now. So we'll be serving you more helpings as they come in. We're talking cancer advocacy this morning, and if you want to join the conversation, feel free to do so. And that's on 080-99-120-777. All right, so Dr. Habib, let's get back to the conversation. You were talking about exposure to certain chemicals. A lot of times, most of us are very used to making use of body sprays, using perfumes and all of that on the skin. Does that pose any danger? Can that cause skin cancer?
Well, there are not enough researches that have suggested that. We don't have enough research to suggest that that can cause melanoma. However, as much as possible, it's better to limit exposure to chemical where possible.
Okay. All right. So let's talk about those that bleach now. I know when we talk about bleaching, a lot of women are culprits in that regard. Can that have any much effects on the skin that can lead to melanoma?
Bleaching is a form of irritation. Any form of chronic irritation can predispose to cancer. So chronic bleaching can also predispose to cancer. Melanoma is one of the type of cancer.
Okay. So it should be discouraged in all forms. Bleaching.
It should be in all forms. Bleaching should be discouraged.
All right, then 080-99-120-777. Let's hear from you. Message just says, good morning, sir. Can dark-skinned people in Nigeria also get melanoma, or is it mainly for light-skinned people? Tokwe is sending this one in from Ifako. Tokwe, thank you.
So, 19 to 38% of all skin cancer in Nigeria is as a result of malignant melanoma. So the dark skin people can also have it, even though it's more common among the albinos and the Caucasians, but we also still get it.
So people that are called yellow pawpaw, or people that are oyinbo pepper,
they are not predisposed.
They are
exactly.
They are predisposed to it, right? Is that what?
Yeah, they are also predisposed to it.
All right. Okay, let's take this call. Hello there. Good morning.
Good morning, Mr. Victor.
Hey,
I didn't get the last
very
statement.
good. Just hold on there, Dr. Habib. Afolabi, it's nice to hear from you. Good morning.
Yeah, this is Afolabi. Yeah.
Go ahead.
Yeah, how are you, sir?
Very good.
Dr. Habib, well done. Yeah. Sorry, quick one. What about the exposure to sunlight? Can you also call melanoma? The real exposure to sunlight?
Okay.
Thank you.
All right. Thank you so much. Exposure to sunlight is what Afolabi is asking you, Dr. Habib. Can that cause melanoma?
Yeah, exactly. That is one of the major risk factors for melanoma, exposure to sunlight, because sunlight has ultraviolet radiation, which is an ionizing radiation.
So what do people do? What should we do? I mean, we are in a kind of climate where the weather is so hot and we have to go out all the time. What are we supposed to do?
Okay, so as much as possible, if you can be under the shade, you are under the shade. And also, especially for younger albinos, for children that are albinos, you must wear face cap and long sleeve for them and keep them out of the sun as much as possible, especially before the age of 18. Because this irritation is more important among young people because cancer takes a long time to develop, and the younger to manifest, and the younger people have more tender skin than older people. So the exposure is chronic exposure, not just one-time exposure. So as much as possible, you can prevent direct contact with sun by wearing long sleeve, by wearing face masks, and all that. But it does not mean that you cannot come out to the sun, because the sun also gives vitamin D, and it also has its own effect, in causing sanitization to, So we are not saying it should not come out of the sun at all. It's just that you do moderation. And for those who have higher chances of having cancer, like who are more predisposed, they are more cautious with sun.
All right, then 08099120777. Another message here says, Doctor, what are the early signs someone should watch out for on their skin? You didn't put your name. Thank you so much. Even though Dr. Abib was talking about that earlier on. This one says, good morning, Doc. I have a move. Okay, no, it says I have a mole that has been there since childhood. How do I know if it is dangerous? Rukayat from Songo. Thank you so much, Rukayat.
Okay, for the mole, you just have to continually observe it. If there's any change, change in color, change in regularity of the margins, or if the rapid increase in the size of the mole, or if it crossed and forms an ulcer, then you need to see your physician so that it can be detected early. And these are what we look out for, on the skin, so as not to, present late if it does come.
Right. All right. You said it's curable, right?
It's curable. It's curable if the presentation is early. That is, if the person presents to a doctor early enough and is caught early.
Okay, so for those kind of signs you mentioned earlier on, will there be itching? Is itching part of it?
Itching is part of it. Thank you. Itching is part of it. Change of color is part of it.
All right. Message here says, Mr. Victor, happy new week and good morning. Please, my question is, it says my question is melanoma. Okay, I'm trying to get this. My question is that can melanoma occur on parts of the body that are not exposed to sunlight? Thanks, Mr. Godswill. Godswill, thank you so much.
Oh yes, it does occur on parts that are not exposed to sunlight, especially in females. It does occur on parts that are not exposed to sunlight.
Okay.
Especially in females.
So any part of the skin, it can occur in any part of the skin?
It can occur any part of the body, including the eyes. It can occur any part of the body.
Wow. All right. 08099120777 09153877127. How is melanoma? How is it diagnosed, Dr. Habib?
To diagnose melanoma, we normally would do biopsy. There are different types of biopsy. You can shave biopsy, punch biopsy, incisional biopsy, excisional biopsy. All this entails taking sample of that wound or of the site and taking it, of the skin, taking it to the laboratory, and they use a microscope to examine the type of cells that are there. So that's how we diagnose it. And like I said earlier, melanoma can spread. So to see how much it has gone, what we call staging, we can do chest and abdominal CT. You can use imaging modalities, different imaging modalities like CT scan, MRI, X-ray, ultrasound scan to know how far it has spread.
So even though this occurs in the elderly, or let's say those that are advanced in age to a certain level, 50s, 60s, 70s, but is it uncommon to find it with young adults?
You can find it's also commoner in young adults than in children, especially in this part of the world. In our own part of the world, cancer generally occur a bit earlier. So we also find it in young adults.
Okay. And that really calls for caution too. All right, then 08099120777. This one says, good morning, doctor. Can children also develop melanoma? Miriam Ajayi is sending that one in.
It is not impossible. It is actually not impossible, but it is uncommon. We see it more in elderly.
Right. Okay, then. So for us to prevent melanoma or perhaps any form of skin cancer, what would you recommend, Dr. Habib?
I would recommend that we are observant. Many of the factors that predispose to melanoma, we don't have a say, on those factors. The factors we are born with, like for example, if it is familiar, that if it's common in the family, or if you have multiple moles, or if you have multiple birthmarks, all this we cannot control. We just need to have high index of suspicion. However, there are some we can control. You can limit your exposure to direct sun. You can limit your exposure to chemicals. And with this, hopefully you reduce the risk of having it. But very importantly is that we should have high index so that even when it comes, you present early and it will be cured easily.
And do we have dietary patterns that can help the skin?
Melanoma has not really been linked much to diet. However, melanoma also occur more in people who are immunosuppressed. That's people whose immunity is low. So diet, that's where the role of diet comes. If you have balanced diet and your immunity is good, you are also deterring melanoma. However, if diet is poor and immunity is low, that also predisposed to having melanoma. So that's the role of diet.
All right. So melanoma, if you look at it as a cancer, is it a quiet kind of cancer? Is it calm or is it aggressive? I mean, is it a kind of cancer that if one gets today, before the next 48 hours, it could do some damage?
Even though melanoma is a very aggressive form of cancer, but usually when it starts, it does not cause pain. The wound is usually painless. It's not very painful, and initially it's usually a slow-growing tumor. But when it becomes aggressive, it becomes very fast, and the downside of melanoma is that unlike other skin cancer, it has the propensity, that's the ability to spread at an early age. And this spread, which we normally call metastasis, is what makes melanoma a more dangerous skin cancer than other skin cancer. Anyway,
let's bring it home now, because there's a lot of times there's always a spiritual dimension to it. Anytime you see people coming down with one or two things, Dr. Habib, spiritual attack, juju, or all those kind of stuff. How would you address that to those that are listening to us this morning? There are lots of families, when they see this kind of thing, they say, no, this is a spiritual attack. What would you say to them?
Well, the truth is that in this part of the world, we attribute spiritual attack to almost every illness. However, what I will say is whatever spiritual method you employ, you should also employ the orthodox method, the one that is confirmed. That's come for treatment, either surgical excision, immunotherapy, or radiotherapy as deemed appropriate by the physician. So whatever you think about spiritual manipulation, is good to come to the hospital so that you have your treatment, and whatever spiritual you want to do, you do it to assist the treatment because the treatment is confirmed.
All right. Okay. Let's see. Do I have a call there? Okay. All right. So let's begin to take this home this morning, because I know we didn't really have too much time. So for those people that come down, they see this kind of symptoms, the signs that you've mentioned. Do we have equipment to really treat people with melanoma in Nigeria?
Oh yes, we have equipment. If you present at the right facility, for example, the MedServ Loop Cancer Center, we have all the equipment, all the facilities required for treating melanoma, especially when it comes early.
What about costs? I mean, some would say, well,
the cost.
Yes. Some would say they won't want to show up in any of those facilities because of cost. Maybe probably it's too costly.
I can assure you that when it comes to cost, it is far more cost efficient to present in an hospital than not to present, because the cost of not presenting is life. It takes life if you do not present. But when you present, at least there is a cost to it, and if you can pay to get treatment. In a center like Method Blue Center, we also do sponsorship for the indigent. When patients present at Method Blue Cancer and they are unable to afford treatment, what we do is we have a committee that assesses how indigent the patient is. If the patient is actually indigent, is truly indigent, we have a fund that we use to sponsor indigent patients radiotherapy.
Okay, then.
Yes.
We'll leave it at that for now, yes. Dr. Habib. It's nice having you on the program. Thank you so much for connecting with us this morning.
You're welcome. Thank you for having me.
Okay, then. So we're looking at cancer advocacy, unmasking the A to Z of melanoma in Nigeria. And you heard from my guest, it's a kind of skin cancer. If presented early, can be effectively tackled. Dr. Mohammed Habib is consultant, radiation and clinical oncologist. He is also the chief clinical coordinator for MedServ Luth Cancer Center. We have to go. The program this morning has been produced by Akan Hussein. Maximum shout out going out to Onora Moluku, who's a cancer advocate and who's also trying to ensure that Nigerians have the best of information that they can really use, and then they can live much better lives. Daniel Downsey and Remy Aloko, both of them of our social media unit. Our executive producer is Tayo Akonle. My name is Victor Oteri. Have a great day. Bye.